Good morning, everybody. Hope you all had a wonderful Memorial Day. My name is Rolando Mia. This is Dr. Tom's Tips on Tuesdays at 10 with Xyrus. Welcome, Dr. Hirsch. Welcome, Danny. Danny Rice, Dr. Tom Hirsch's registered dental assistant. The purpose of this series is...
Hello.
The purpose of the series is to share with you tips on utilizing the Isolite. Today's topic is around how to integrate Isolite and introduce it to your dental assistant. So Dr. Hirsch, what tips would you like to give our viewers, our audience about that?
Well, first of all, Rolando, the first thing that I want to say is don't call me Dr. Hirsch today. Call me Pat. Pat Sajak, because obviously I'm here with Vanna White. Come on, you guys. What can I say about that? So, Rolando, today my name is Pat. And I'm going to tell you, Pat just became a dentist, by the way, and Pat's going to tell you certain tips on introducing Isolite to the dental assistant and how and just in that aspect and how she might want to work with it. One of the important things that I just always want to address is the fact that with COVID-19, we want to keep that airborne aerosol out of the mouth. We want to keep all the bacteria in as much as we possibly can, reduce that airborne aerosol. So that's one of the prime reasons why I use it in today's subject, is because it reduces airborne aerosol. But let's talk about tips with the dental assistant. So tip number one, I personally have developed a way of putting the Isolite in the mouth. I fold it over, I put the cheek side in first, I pull the bite block across, I kind of tuck everything in, and I have it go right to place nice and easily. That's the way that I teach my staff. That's what I want them to do. So we always, at the very beginning, and an important tip, have a team meeting with your staff, with your assistants, front desk, hygienists, assistants, and you. Team meeting, all get together so that you can show them how to put the Isolite in the mouth properly, so that you can show them proper sizing. So I've got my technique, and I swear Vanna over here, as much as she goes to use my technique, won't do it.
It's a little bit different.
I look at it, it's a lot different.
Well,
but it
works.
It works.
And that's important.
Yeah. She has her way, I have my way. So tip number one in this whole thing, when somebody has success in doing it their way, let them do it their way. Don't sit down there. Don't force it down their throat. Don't say, hey, you have to do it this way because this is the way that works. You know, she has her way. Let her do it. So my way was to do that. Danny, describe your way.
Well, I fold the mouthpiece over, and then I sort of give it a little twist, and then I put it into the vestibule, and then I pull it over. So that seems to be the best way for me. Not the same for everybody. Dr. Hirsch has his own technique, and mine's just a little different, but it works for me.
Yeah. So be the boss, but certainly let people do what they want to do. Let them do it their way. You know, who did that song? Frank Sinatra, My Way.
Oh boy. So I heard two tips there. Tip number one is make sure you educate your team so that they all understand what this is. And I love the context behind that. And then tip number two is, after the education, the training, if someone has a little bit of a different way of placing it, let them. I love that. I love that. Right?
Absolutely. Here's a third tip. When I'm working, honestly, I'd rather be in the mouth by myself. When I've got the isolation that I'm required, that's all that I want. And I want to just be in there and I want to do my job. Danny is there. She can evacuate or not if it needs to be done. So my tip number two or tip number three, be flexible, delegate. If she doesn't need to be there, let her roam.
I can go grab materials from another room. I can go take x-rays in another room. I can prepare other materials. There's so many things that I can do while Dr. Hirsch is busy working on a patient. While he's prepping, I can get my cements together. I can get my cord together, and it makes everything run so much more efficient.
Awesome. So Danny, what 2 or 3 tips would you give dental assistants who are new to this, or dental assistants who've been using it, to help them in integrating that, specifically around, being with or leaving the doctor?
Well, you want to come back, You can't just abandon your doctor. But probably the biggest tip is to make sure that you have the timing, and make sure that the mouthpiece is in place properly, so everything's sealed off, nothing's going into the patient's throat, and make sure that he's set before I leave the room, and obviously make sure that I come back. Not sure if I answered that question completely, but
no, you did. So the tip is make sure you're mindful of the amount of
yes,
time. So
always
if
be
you
mindful.
leave, yeah, if you leave to do something else, you're able to come back. You mentioned one of the tips in there is this whole context of getting materials ready. What are other things in addition to that are tips to help other dental assistants out there figure out or integrate the Isolite into their day-to-day? Like, for example, related to being in the mouth or not in the mouth.
Yeah. Here's what I think in that aspect. I know you're asking Danny, but I'm going to jump in on this one here. Being in the mouth or not being in the mouth, if there's a lot of airborne aerosol, be in the mouth with your HVE. If the airborne aerosol is under control, go do something else, but you want to be right there to capture that airborne aerosol. So sometimes, depending on the angle that I'm working with a handpiece, there may be more airborne aerosol that's going to hit the Isolite and bounce around a little bit. And if we can mitigate that situation by being in there with the HVE as well as the Isolite, perfect. If not, we don't.
Awesome.
Does that answer that question?
Yeah, perfect. Now, Danny,
it is.
From a learning perspective, awesome. What tips would you give dental assistants regarding how to learn and become comfortable using the Isolite?
Well, first of all, the sizing and the placement is very important. Also making sure that all the airways are sealed off. That's another way that the sizing is also important, because you don't want anything getting past. You want a good seal. And also to evacuate all the aerosols, everything has to be perfectly sealed off as well. Another tip would probably be to make sure that the light is on, make sure that the mouthpiece itself, everything is cleared out, because if it's not cleared out and not cleaned properly, the suction will not work properly and therefore is less effective.
Awesome. Now,
I'm going to throw something in here right now, too, from just what Danny said. She said she's right there. This morning, for instance, we're cementing a bridge, and I've got the Isolite in, and I've got air abrasion. I've cleaned it all up. Every single time that we go in there and do this, I've got the light on, and Danny has to remind me, Doc, change the light over. So I've got to listen to her. Change the light over to the amber light. So that's really important that you listen to your assistant. When she tells you what to do, you do it too.
Yeah, that's very important, I would say. So the one final question here, Danny, what tips would you give dental assistants when they encounter a patient that may be struggling a little bit with that mouthpiece?
Well, there's a couple things that I do. One is the way that I place the mouthpiece. I sort of give it a little twist so that it's not affecting the palate and the gag reflex as much. Secondly, sometimes we do trim the palate just a little bit in order to not aggravate that gag reflex as much. So those are a couple tips.
Awesome. So what I'm hearing, first of all, it's really important to get comfortable with sizing and placement, and we've covered that before. Yep. Second thing, sealing is a very important aspect of it. So as a dental assistant, as a new user of Isolite, make sure that when you place it, seal it. Third, it's important to recognize that you can, if you want, use the HV in there or not. But one of the things that Isolite does is it enables the clinician to work by themselves. Is that right so far? And then the last thing that I heard, go ahead.
No, go.
Yeah, and then the last thing that I heard was that from a utilization or a use perspective, important to make sure that if you're going to leave, time it in a manner that you're there when you're needed, but you're not there if you're not, and do other things. Did I get it?
You got it.
You got it.
I'm going to give you one more thing right now. I know we're running over a little bit, but right now we were in the other room. I have a patient. We're taking an optical impression for an implant crown right now. So I was in there, but we got close to the time that I needed to be in here. So I got up, I left, and I told my assistant, finish the scanning, do the lower arch, do the upper arch, do the bite. So she's in there doing the scanning right now while Danny and I are working and talking to you right now. So it gives her some autonomy, and it gives her that extra set of hands that she needs, which is nice.
And if I understand correctly, for extended function dental assistants, you can work by yourself. Is that right?
That's right. Danny's actually enough that I didn't have enough room to put it on there, but I can feed the room. She can put a
compact cord, cement, fill temporaries, all of that.
Occlusal
all
composites.
Of those
Yeah. Oh yeah.
Well, first of all, thank you. Thank you so much for taking the time with us. Thank you for sharing those tips. Those of you who are watching, if you have any additional questions or if you need anything else from Dr. Pat and Vanna EFDRDA,
very good.
Let us know. Thank you for taking the time to watch Dr. Tom's Tips at 10 on Tuesday. Look forward to seeing you here. If you like this, please share. If you have questions, please send them to us. If there are additional things that you want to understand, send them, and we'll make sure to cover them. Thank you so much, folks. Really appreciate it. Danny, it's great seeing you. Dr. Pat, it's always a pleasure to see you.
Thank you, Vanna. Thank you, Rolando.
Have a great week. Thank you, guys.
Bye, everybody.